The 2014 Fine Awards for Teamwork Excellence in Healthcare. Silver winner, Children's Hospital of Pittsburgh of UPMC. Creating a culture of excellence in central line care.
When we moved to this new building in 2009, we actually were expecting to see a decrease. Brand new building, not a lot of germs running around the building, but what we saw was the exact opposite.
Previously, the NICU was one room. Family and visitors were not permitted to bring personal belongings into the room. They had to be placed in lockers.
We did go from a single open room setting to single patient rooms.
With the transition to private rooms, families can wash in the room and bring in their personal belongings.
And we were wondering about hand hygiene practices, not only staff but families, and we started looking at why the infection rate was rising. So we did have to do a lot of reminders that we're washing our hands frequently before we touch your baby. We need you to wash your hands frequently before you touch your baby as well.
That's all we hear all night long. Because they wash in and out all the time. And they tell us, before you do anything to go ahead and wash.
Ultimately, the CLABS Prevention Bundle was born.
What composes central line care? So is it how we're putting our lines in? Is it how we're taking care of the lines? Is it the fluids that we're giving? Is it just our patient population? The first step to our bundle of central line care would be at the time of insertion. And anyone who's going to be in the sterile field will put on a head barrier, a mask. They're going to wear sterile gloves and have a sterile gown on.
Nurse practitioners routinely insert PICC lines in the NICU. They perfect their skills in the simulation lab.
So I'm going to use my tweezers and insert the PICC line through the catheter up towards the large vessel near the heart.
To complete the procedure, we'll just review the procedural checklist. Prior to beginning, everyone washed their hands, and that was done. Everyone in the sterile field wore masks, head covers, sterile gowns, and sterile gloves. Maintain sterile technique throughout the entire procedure.
The second part of the CLABS Prevention Bundle is care and maintenance.
When we initiated our project and started monitoring our central line care and maintenance, we did education for all the staff on Scrub the Hub, and we went to a 15-second scrub.
By using a UV light and showing the staff the germs that remained after a 5- and 10-second scrub, it was clear that a 15-second scrub was best.
So we did have people practice, but the nurses are pretty good at looking at the clocks in the room. Along with that, we have the central line dressing change, sterile tubing change. We also instituted a daily discussion of the need for the line. During rounds that we discuss all patients, we do bring up the fact that the patient has a central line, and if that line is still needed, how long is that line is still needed. Our clinical leaders have various parts of monitoring. She checks to see if they're positioned up and away. She checks to see if there's a date on the dressings and that the dressing has been changed per our policy, which is every 7 days. I was in several meetings where they would say, but the NICU has the lowest infection rate, and we were always very proud of that. So we gladly met with the other ICUs. They also went to a 15-second scrub the hub with the dry time. After the move to the new hospital in 2009, they were fluctuating anywhere from about 3 to 5 per 1,000 central line days. And currently we are below 0.5 central line infections per 1,000 line days.